Bismillah ar-Rahman ar-Rahim. Good evening and assalamu alaikum to all of you. And let me start by saying, Dr. Inam, it's lovely to see you. It's been a long time, I think. We've not met each other.
Been a while.
As always, you're keeping up the good work. So thank you for that. And let me also take the opportunity to say thank you to Ask Doctors for many, many years now that you've been engaged with challenging and reducing the health inequalities that exist. Clearly, you are from a medical background and you've seen it firsthand. But I think most of us have also now seen some of the health inequalities. One of the things definitely that has come through with the COVID-19 has been shone a light on the inequality that exists in a society that clearly has been exposed. And I suppose it's appropriate that I should say thank you to all the doctors, the NHS, workers, the frontline workers for the whole role and the work they've done. It's been tough. It's been tough. I think this is the easiest way of saying the whole thing for all of us. I think in three different ways it's been tough. One is the health aspect, which you, of course, you know more than anyone else. The loss of human life has been huge. Almost all of us, some way, directly, indirectly, we've been touched by this loss of loved ones. And then I think it's been a huge economic impact, which has had on people's lives. I mean, I represent Manchester Gorton, and I know how difficult that has been for many people. I've carried out a number of surveys within the Manchester Gorton constituency, sort of 4 or 5 months apart. And again, what comes through is people's insecurity, both financially as well, is there now. So it's the health, and then it's this. And the other one is the mental aspect as well, actually, is taking toll on people's lives. So it really has been tough. And it's wonderful to see where we are now, that we can see the light. The vaccination was the solution ultimately, and we have that, and we are clearly making progress. But then there still remains a concern, particularly those communities, who have been hit the hardest. You also find that the reluctance, and there's lots of reasons why there's a reluctance there, but they're also being left behind. I've looked at some of those figures, and I'm concerned. I've been concerned throughout this journey, how things have been handled by the government. But then I think now that the light is there, then seeing the concern, the lack of take up the vaccination, the gap that exists between different groups and communities is shocking, actually. And more work that we all can do to remove that, the better it's going to be, because at the heart of the argument ultimately is if we're all vaccinated, we're all protected. If a section of the communities are not, then we're all vulnerable. So therefore, there is a mutual benefit and the interest that we actually do that. And thank you for the work that you've done on the languages side as well. I mean, I remember when the whole pandemic started, asking the question in Parliament on this, what are you doing? And a month later, after asking the question, again, I found nothing was being done by the government. And the health minister was actually standing on the dispatch box and giving us the figures, how far ahead London was and how bad the situation was in London. And I thought, can't you see the connection here? London is also the most diverse, and you are totally silent on that. And the only answer they could come up was, look, the message is changing, and that's why we've not been able to deal with it. But look, you can deal with everything else. This is also something you can deal with. So you've done an amazing job, doing 33 different languages. So you as a voluntary organization, you could do so much. Can you imagine the resources the government has? Why do you think they can't? Come on, they need to actually. But I'm glad where we are. And I think what we need to see now is put this push. It's about message, making sure we get the good, correct message. Challenging the wrong information that exists in our society. People are peddling in the WhatsApp groups and other social medias. And then also the messenger is also important, the people who people can trust.